Hi, my name is Courtney, and I have chosen to discuss opioid addiction in nurses. I've chosen 3 objectives for the learner: to recognize signs and symptoms of drug addiction in the nursing profession, identify contributing factors in nurses, describe what to do if you suspect a coworker is abusing opiate medications. Nurses are one of a kind. They endure so much on a daily basis, and as nurses, we are known for our comforting care, our healing touch, and our compassionate hearts. To many in the profession, it is a calling, but what our patients, their families, and even our fellow workers and loved ones sometimes overlook are the high demands nursing has on our daily lives. Substance abuse occurs throughout our society regardless of race, gender, age, and social status, including nursing and healthcare. According to Thomas and Sela, 1 in 10 or 10 to 15% of all nurses may be impaired or in recovery from drug addiction. Impaired nurses can become dysfunctional in their ability to provide safe, appropriate care. Addiction is a disease, but the addicted nurse still remains responsible for all their actions while at work and when caring for their patients. Nurses endure high levels of stress and burnout due to long hours, mandatory overtime, and high workloads. Substance abuse may be a way that they cope with these increased demands. Some risk factors that have been identified in drug addiction in nurses are low self-esteem, depression, work-related injuries, knowledge of medications, and family history. Night shift nurses also have a higher risk of drug dependency. Drug-addicted nurses tend to minimize the seriousness of their abuse. It is rare that they seek treatment on their own. These nurses are fragile and must understand that drug abuse impacts their ability to practice safely and that their license and employment are at risk. We need to recognize the signs and symptoms of substance abuse in our coworkers. These may be lack of coordination, altered cognition, impaired memory or attention, frequent and accumulating absences or tardiness, unkept physical appearance, isolation, irritability and mood swings, slurred speech, requests for additional overtime, and lethargy. The National Council of State Boards of Nursing state that nurses who suspect a disorder in their coworkers need to be provided with guidelines and a clear process for reporting their concerns in a discreet, non-threatening manner, which will in turn increase the likelihood that the issue with substance abuse will be detected early and dealt with appropriately. The ANA supports assistance programs that offer comprehensive monitoring and support services to assure safe rehabilitation and return of the nurse to their professional community. They also recognize duty of compassion and caring extends not only to nurses as well as their patients. So what can we do if we suspect a coworker is addicted to drugs? Addiction is an illness and recovery is essential. We need to talk to management. Employers may offer treatment programs. We should not approach these nurses directly, but brushing it aside is not the answer. We owe it to our patients to give them reliable, quality care. There are substance abuse organizations, peer assistance and educational programs, and intervention programs where RNs sign contracts that they will undergo rehab therapy, frequent drug testing, and 12-step programs. Many nurses are not educated on how to recognize or intervene with a colleague who is abusing drugs. Too many healthcare facilities choose to terminate employees with addiction instead of dealing with the issue at hand, leaving these nurses to apply to other healthcare facilities, putting additional patients at risk. Substance abuse in nursing, specifically narcotic abuse, can jeopardize our patients' safety. First and foremost, reporting a nurse with a suspected addiction disorder only assists in preventing injury, medical complications, and medication errors, and even death to our patients, but also provides help for that nurse and may save their life as well. So understanding the importance of recognizing signs and symptoms and how to notify your employer about a potential nurse addict is key and significant in practice. We need to be increased in awareness of addiction and support our coworkers as they can get the help they so desperately require. Please read the case study and answer the following questions. Thank you for your time and patience. Have a good day.
created using Powtoon.